Ben Bornstein is a consultant from the COVID Medical Network. Ben, thanks for joining us.
Thanks, Ryan.
What treatments are available in Australia for people who test positive for COVID-19 if they're showing mild or maybe no symptoms?
Well, I think that question brings up the status quo here, which is the advice that we're given from our National Clinical Evidence Task Force, all ministers, etc. It seems to be wait at home. I've heard it phrased the rot and see. If you get worse, go to hospital. There are no treatments, no early treatments proposed at all. And that's absurd for medicine. Every doctor you speak to, there's not a single condition that you would treat like that normally. That is, wait and see if you're bad enough to go to hospital.
Is this the same for all age groups, including maybe the aged?
Look, in raising the aged issue, it's really important to understand that this disease is statistically showing to affect age groups at very different levels. And those statistics are not that easy to find. But if you go to America's CDC, you're able to find statistics that go over the deaths by rate, by age groups. And there are other other areas that you can look at. They don't put it all together for you, but Statistica is one that tells you what is the population distribution in America. And finally, another website gives you the number of tests and the number of deaths in America. With a year's data, you can get a good idea of what the spread of death is by age group, what your probability of death is. I've calculated it. It'll be within plus or minus 10%, these calculations, I'm sure. But the mortality rate for the COVID-19, even if you don't get treatment up to the age of 44, is a fraction of a percent. It's less than 0.3% with no treatment.
Interesting, the government, whether it's state, federal or even local governments, the medical fraternity come out and say all this misinformation is just creating havoc. But what they're not doing is creating or telling us exactly what's happening. The information is not there, so that leaves us void for all sorts of information aspects to pop into it, doesn't it?
It does. Look, I think that the Clinical Evidence Task Force have taken the approach of what can't be done rather than what can be done, and anyone can tell you what can't be done. It is, I think, shameful not to be looking at what can be done and not to talk to practicing physicians abroad that are successfully treating people, statistically successfully treating people early. It seems to be a virus that, like most viruses, if you can get to them early, you'll get some effect. So in the first few days of symptoms, that's when you need to see someone. Yet the advice we have, the standing advice, is don't go and see anyone. The doctors are scared to see anyone. And so wait until it gets worse. And there's a thing called a cytokine storm that happens when you wait long enough. That's when you go to hospital. That's when your immune system, it's no longer the virus, it's your immune system is trying to compensate, and it's what takes you down, not the virus.
Interesting to note that the bureaucracy know a lot more than doctors, so that's always one to put in our hat and throw the hat away. Does the USA set the standards or guidelines on the treatments in Australia?
Well, I think the answer to that is not officially, but sadly, through association, the FDA, the CDC and the NIH have all shunned and you could say they've even steered away from early treatments. The motives for that we can go into later, but it's more important to know that there's no push to work with the early treatments that so many doctors around the world and outside of the US and outside of Australia are finding success with. I think there's a term I'd like to introduce to this now, which takes it straight back into the camp of those that would be saying don't use early treatment. Let's coin the phrase early treatment skeptics.
Can you tell us on what or whose authority treatment is determined in Australia?
Look, it seems like I would say Associate Professor Julian Elliott heads a Monash-led task force telling us what should and should not be done. And through their recommendations, For example, our TGA, the equivalent of the FDA in America, and probably a bit of a puppet to the FDA, or at least seems to copy it, John Skerritt seems to be heading the TGA. I think they're really aware that early treatments are working, but they are steering us, the public, away. It feels like we are pawns in a game.
Why would they be steering us away? I mean, I noticed on the on Monash University on their stationery, it says, no matter how bad you think coronavirus is, it's worse.
Look, that's a good point. And you know, we could get drawn into that discussion, which would then take away from the clinical evidence that can be presented to show just how powerful early treatment is. If I was to go down that path just a little way, when the population has no choice on treatments, then there's a fear factor that's brought in. And with fear, people will listen. They'll say, what is the solution? And if they're told there is no solution except perhaps a vaccine, and wait for that vaccine, and lockdowns and shut down your schools and put masks on, it becomes almost unquestioned. But if you do question it, then all of a sudden the catchphrase throws out there of, well, it's misinformation, the real misinformation. And this is true. The real misinformation comes from the burying of the evidence for early treatment and the glossing over of the dangers of introducing vaccines at warp speed.
It's just been this media circus. They really add fuel to the fire, and the clickbait must be enormous. But I've seen such horrendous headlines of this, and it's all, it has to come from somewhere. So they seem to be all in this great little team. You've got the government, you've got the bureaucracy, you've got the part of the medical fraternity, you've got those who are looking at this as a profit centre, as a business. They're all in this little boat together, and it's this same narrative. So you're right. If you are to question that, I mean, it's almost like the pointing at the witches. Oh, they're coming out with these untruths, but this is what science is all about, to be able to discuss. Doctors are doctors. That's what they're trained to do. They look after the patients, and just probably keep big government or government out of this altogether in some cases.
Yeah, it seems to be, there seems to be both money trails, power trails, and mates trails, where you rub one guy's back, he'll help you. I'll give you interviews if you toe the narrative that I've got. But in the end, the data's there, and it is so compelling. Anyone can look up, for instance, on hydroxychloroquine, a website, hcqmeta.com. That's hcqmeta.com. It's all being compiled there. It is astounding the amount of evidence that is being ignored by our National Clinical Evidence Task Force, and headed by Associate Professor Julian Elliott. We would like to put, when I say we, I work with the COVID Medical Network, we would like to put these professors and these academics in touch with the doctors that are treating thousands of patients, that can give them clinical advice rather than theoretical advice.
Interesting. They say the medical fraternity is a closed shop. This probably enhances that theory. Ben Bornstein, how do we find out more about COVID Medical Network and the website and other means?
Yes, if you just string the words together, covidmedicalnetwork.com, you'll find us, and there's a lot of information to be found there. But basically, webinars are on there, and the facts section, and always facts are contentious. I'm dubious of any site that says fact checker. But look through the facts and the information there, just so that you can have you can be informed. And this is a theory we'd like to pursue in the future: informed consent.
Things are really moving at a rapid pace, but some interesting questions which we must develop in later episodes of Asia Pacific Today. Ben is from the COVID Medical Network. Thank you very much.
A pleasure.